with the Washington Hospitality Association. Today's topic is coronavirus and you, and mostly a Q&A session to help clarify some of the issues that are floating out there affecting the industry. Today with us is Catherine Morissette, who is a partner at Fisher Phillips in Seattle. She advocates for local and national employees in litigations in state and federal courts and appeals. And she's with us today to talk about this topic. We also have Julie Borton, who is the Director of State Government Affairs for the Washington Hospitality Association. Julie has been with the association for more than a decade and oversees the association's state advocacy and political programs. Samantha Lauterbach is also with us. She is the Washington Hospitality Association's Government Affairs Senior Manager with history working in the hospitality industry. She is our expert liaison with the State Health Department. And finally, we have Jillian Hentz, who is the Washington Hospitality Association's Senior Communications Manager, who will also be here. And she'll be talking about some of the resources that she's found and communicating with the National Restaurant Association and American Hotel and Lodging Association communications departments. All right, with that, we'll get started. I want to start with you, Catherine. As somebody who's serving both restaurants and hotels, what would be kind of your initial thoughts on how members should handle this topic?
First thing is to be sure that we are handling the topic, so I'm glad everybody's on the call today. There's a couple different pieces to think about, right? We have to think about how we're going to handle our employees who want to feel safe and we want to be well, how we're going to handle our operations if the worst should happen and there's some closures. Also, I think folks are thinking ahead, being concerned about seeing their business and their guest count change as we go forward. And I guess I said two, but I'm going to lie and say there's really three. The third thing is to think about what we can and can't do vis-a-vis our guests.
Everybody, one of the things that we have a chat in your client that you logged into. Please enter your questions through that chat client so that everybody can see it, and then we will ask it to the group here as well. Going into the next thing, Samantha, in your interface with the health department, what are some of the things members need to look out for?
Our communication with Department of Health has been focused on how businesses can prepare their employees and businesses to stay safe. So the Department of Health has definitely encouraged and emphasized educating employees on what the signs are and symptoms of coronavirus for their own health and safety, but also revisiting those safety procedures that we're already practicing in our businesses. So an emphasis on hand washing, sterilization of tables and equipment, and things like that.
And I'm going to piggyback off of that and talk a little bit about the Department of Health. They are doing a phenomenal job with their communications, and their website right now, I'm really using it as my guiding light. There's a lot of news stories out there that can cause panic, that have scary headlines. We know that the media does actually earn revenues off of people clicking on things, so they're going to make headlines really clickable. So to help me stay sane and to help guide all of you amazing members, I have been using that website as my guiding light. And just the update date is updated every day at 11 o'clock. So you can log on between maybe 11 and noon every day and have the update for the day. I checked it this morning, and it looks like we are at 136 confirmed cases here in Washington State. We have 18 deaths, and 17 of those have occurred in King County. And the affected counties right now are Clark, Grant, Jefferson, King, Kittitas, Pierce, and Snohomish. And I looked every day. At this time last week, the State Department of Health said that our rate for Washington State residents was relatively low. And then last week they upgraded that, and now they say that coronavirus is spreading in several counties in Washington State, and risk of exposure is increasing for Washington State residents. So So I am just checking that website every single day and seeing what changes are happening. And I would encourage you all to do the same just to stay sane.
Okay, so we'll go on to the next thing. Julia, anything from the state government affairs? It looks like we've got some background sound, so I'm going to try to, Jillian and Catherine, I think when we're not talking, maybe we'll try to mute ourselves. Maybe that would be, that will help folks hear. But right now we'll go ahead and see there. Okay. Okay, go ahead, Julia.
Okay, thank you. So there are 4 days left of the, I don't know if the background noise is getting better or worse. So there are 4 days left of the legislative session. The state legislature did just pass a $100 million relief effort. Primarily, those funds are directed at local government as well as nursing homes to make sure that they have adequate systems to keep their patients safe. We are working with state leaders, the governor's office, to see if there's any additional response efforts that can be targeted towards businesses. But again, there are 4 days left of the legislative session, so we're working quickly to see if there's additional issues that can be done to support.
Let's see, in terms of questions here, we just had a request for somebody to put up the website. Looks like Jillian, you sent that into the chat, so we've got the website from the Department of Health up there. Catherine, what are some other topics that there's a lot of misinformation out there? What are some of the main myths and misconceptions that people have in regards to this outbreak that people need to be aware of?
I think I'm getting a lot of questions about leave and leave rights, which I believe are stemming from some employees being concerned and not having good health information. I want to echo what everybody has said. The State Department of Health website is excellent. The CDC keeps updating everything, and even the World Health Organization. I hope that we're sharing those resources with our employees. One of the questions that I'm getting a lot is what to do if an employee doesn't want to come to work because they're afraid of contracting the illness. I think we're in a unique situation here where everybody tends to think that tech rules Seattle, and we have had, some very prominent tech companies decide to go ahead and engage in social distancing and have everybody work from home, which is of course not something we can do in hospitality, particularly unless it's an office person, right? So one of the things is to be ready with an explanation to folks. I really like that we keep emphasizing that we know how to handle this because we know how to handle seasonal flu, and our employees should know how to practice safe and sanitary practices already. As far as leave goes, wanting to stay home because you're afraid you're going to get sick is not something that is protected under Washington paid sick leave law or Seattle's paid sick leave law. That would be something that's available if you come down with symptoms, just like you would for any other kind of flu. I've been getting a lot of questions as well about whether even employers could take advantage of paid family medical leave if they wanted employees to stay home, or employees have asked that as well. Keep in mind, those set of laws are set up just for serious health conditions or a serious health condition of a family member. So those kinds of things aren't going to be available until, unfortunately, somebody comes down with the virus or has symptoms. What to do for quarantine period, I think, is a little bit of a different question, but perhaps I'll save that as we move on to a next topic.
Great, thank you. Did I get one question from somebody from the audience here? Is it a good idea to post, from Patrick, is it a good idea to post on website, email marketing, etc., about what we do to clean. For example, using a 1% bleach solution to clean hard surfaces, washing all room items after every guest, etc. Thoughts from the group?
It looks like Jillian just added the link to the EPA's list of registered cleaners that DOH is suggesting that all hospitality businesses take a look at. And so they'll have the list for you. In regards to marketing, that would be a Jillian question.
Yeah, definitely. I have seen on social media already restaurants posting signs about their best practices. And honestly, especially food service, there is no industry better prepared to take this thing out and prevent the spread. So I think that talking with your customers, if you want to post a sign or just a little tabletop or on tables or at the front of the register, I think that's a great idea. In some of the counties where it's not hitting yet, in Eastern Washington, for example, it kind of gauge what your customers are talking about. I know that the team here in Olympia says, "Oh gosh, restaurants are super busy right now." Well, there's no confirmed cases in Thurston County, so folks, while they're thinking about coronavirus, they may not be afraid and panicked yet to stop going to restaurants. So I say, talk to your customers if you're outside of King County, really gauge their level of awareness and concern, and then base your communications on that. Because the last thing that you want to do is start posting on Facebook every single day about how clean your restaurant is if there's not a high level of concern yet in your county.
And I think the legal thing to keep in mind is sharing what our best safety and hygiene practices are is great. In fact, I like it now when I go to pick up a coffee and there's either, a wipe down or the antibacterial gel sitting right by the touch screen. Of course, we're not going to publish anything that says nobody's going to get the coronavirus, and we promise nobody will be getting the coronavirus if you come patronize our restaurant or stay at our hotel. But otherwise, I completely agree with Jillian that, in fact, this industry, we're ready to handle this, in fact, better than most folks are.
All right, so kind of going through the slides now. On the whole, what should I be doing in my business right now? The group?
I can start with that one. I received a lot of member phone calls. Let's talk a little bit about the lodging side. I am receiving phone calls from members who are concerned about guests who are sick coming in and staying at the hotel. And the advice from the American Hotel and Lodging Association right now says to use best practices. If you see a guest who is sick, they might just have a simple flu. They might have a cold. They might have allergies. So you want to make sure that you're not being discriminatory and just thinking that everybody who walks into your hotel or restaurant has the coronavirus. So there are things that you can do to help prevent the spread, making sure that there are ample tissues on hand around your business if folks need to blow their nose. And trash cans to the side because they can throw them away. Also, plenty of hand sanitizers, making sure that your restrooms are stocked, that they have the hand soap and paper towels available so that everybody is washing their hands. But then again, just making sure that we are not discriminating against guests who come in and may have a simple form of allergy. For restaurants, it's using all of that amazing safe training that we have and just keeping everything squeaky clean. Everything gets wiped down after a guest leaves a table, for example, and just having great customer service. Again, the tissues, the hand sanitizer. I love the idea of having hand sanitizer right by the touch screen as people are placing their orders, Catherine. So really those best cleaning practices right now and things that make our guests feel comfortable and not as though we don't want them in our business.
Right. Thank you, Catherine.
Yeah, I would add what Jillian was saying. So we want to be careful that we are not discriminating against folks based on their national origin or their color. We all have a duty to allow folks equal access to places of a public accommodation, it's called, which a restaurant and a hotel count as that. I've had some questions about whether we could require guests to have their temperature taken before checking in. For example, I had some questions about whether the guests coming in could be required to wear masks, putting aside that the CDC says that masks don't really work. Those things where we would want to be requiring guests to undergo things would not be lawful under a various different set of laws. So we need to really be thinking more back to what you would do for seasonal flu, what you're going to do for your employees. Now that could change if we get different information from the public health departments, but we don't have that right now, and that's what we need to be relying on.
Samantha and Julie, anything to add to that?
I think in regards to DOH and food safety, I think Jillian said everything.
How should my employee policies or protocols change?
Shall I go first on this one?
Yes.
So we actually, the only thing is how should, it's whether you want to. So I think most of the folks here, unless you've got office workers, perhaps in the hotel setting, you may want to consider whether you're voluntarily going to allow some work from home in terms of social distancing, that you're deciding to follow that. You're obviously going to think about the effect that that has, though, on the rest of your workers. If some folks are allowed to work from home and some folks aren't, I think there's some internal employee things to think about there. Your paid sick leave, what is available per Washington law or the PFML, we don't have the power to change any of that. If you do have your own PTO policies, however, that allow for additional time off, you could have some thoughts about whether you're going to allow people to use that if they, for example, needed to stay home for a quarantine period or something like that. But the best thing is to make that decision now as management so that if you get employees asking the question, you can answer. I would say that the majority of folks are business as usual and explaining where people can work from home, that they're still expected to work unless they're sick. And then, I think as far as everything else, I mean, really we're back to let's stay the same, but let's think about it in this context and be ready with the communication to our employees so that we're offering the answers before they're asking the questions.
Okay. Thank you.
And then I have a question for Catherine. When employees do show up to work sick, because sometimes, even the best intentioned employees will show up with a cold or the sniffles. I feel if employers wanting to take their temperature or require a doctor's note, are those things okay?
We have rules under Washington's paid sick leave law that you cannot ask for medical notes until somebody has been out at least 3 consecutively scheduled days. I think the city of Seattle did a good job posting an FAQ about use of paid sick and safe leave that even folks outside of Seattle can use as guidance about what we can and can't ask for. Now, it becomes a little bit different in my mind, and you should work with your legal counsel. If you have an employee coming forward who says that they have been exposed to the virus and are wanting to come into work and have no symptoms, that's a little bit of a different of analysis. But we cannot routinely require everybody to have their temperature taken before they return to work. You cannot ask for sick notes until folks are out for 3 days or more. And then we get into the piece of, well, whether they're sick beyond that or they said they've been exposed, you should go ahead and work with your employment law counsel, because that's going to be analysis about several different laws, including the Americans with Disabilities Act, Washington paid sick leave, Washington similar laws, and some other things that would be specific to that situation.
Along those lines, I've just got this question from Brian in the chat. Is it possible to verify if an employee is ordered to be quarantined?
So I think the question is there a way for us to look up, to check an employee list to see if an employee's been ordered to be quarantined? I mean, I don't really know the answer to that, but I can speculate that that's protected health information, and I would be very surprised if that's public.
Yeah, I would say unlikely as well.
So you would have to wait until the employee was out their third consecutive scheduled day to ask for verification of a medical quarantine.
Correct. And if somebody shows up sniffling and sick, we want to send them home like we would have been doing just for regular flu season.
Okay. How can we communicate with customers? Jill, if you're going to answer this, could you speak up a little bit? We're having some folks having trouble hearing.
Yeah, I'll say a little bit closer too. So I think this just goes back to some restaurants in King County, Seattle, I have seen are already placing signs on tables or at the register or at the front door about best practices, things that the hospitality industry has always done to keep you clean, and maybe even ways that they're stepping it up. And then listen to your customer base, because outside of Seattle, King County, your customers' awareness level and their panic level about this may be different. So you don't want to go overboard. So really tap into what your customer is thinking. Don't be afraid to ask a customer, hey, coronavirus, we hear that it's spreading. We know that there's the cases are increasing rather. How are you feeling about it? And then using that information to tailor your excellent communication about your best practices.
All right, great. We just got another question here from Sarah. If we have an employee traveling to China, are we allowed to require them to stay home for 2 weeks following their arrival back home?
Well, I want to be counting on what the CDC says, although I do believe the entire country right now is the level that it is. You can ask employees to tell you where they're traveling, period. So it sounds like you already have information about the employee is traveling to China. And if you believe that they're in a high risk area, like let's say somebody had been going to Italy, the answer remains the same, which is that because of the potential of exposure, you can ask them to go ahead and stay home for that 14-day period, which is all we have right now in terms of incubation, right? So the question becomes whether you're going to pay the employee for that time or they have PTO available, or how you're going to handle it. And that's going to depend on your policies and what you as a business can afford to do and what you in a business want to do to take care of that employee. So I can't give you a pat answer to whether it's paid or unpaid, but asking the employee to stay home when we believe, based on actual information from the CDC, because of where they've traveled to, it's the same answer as I gave earlier. If somebody volunteers they've been exposed, we can ask them to stay home or provide a note from their physician that indicates that they've tested negative for the virus.
Great. Okay, let's move to the next one. I should
An additional question on this topic.
Oh, great. We just got another question here from Brian. More so on the side of policy allowing additional PTO for the quarantine period, but wanting to verify that they are actually quarantined. This could possibly still be done with requiring a doctor's note to receive the benefit. So that's more of a statement there. Any thoughts on that?
Well, I think I'm not quite sure the context that it would come up in, but if the employee says, I need to stay home for 14 days because my doctor has gone ahead and said that I'm in quarantine, I mean, I think at that point you can certainly ask them to verify the medical reason for their absence of that period. And if somebody is certainly, heaven forbid, actually ill for that period, we're now in the realm of where they might have paid family medical leave available to them, or FMLA rights because they're out longer with a health condition beyond 3 days.
Should we adjust our cancellation policy? And this is I would imagine if you're a hotel and you have a major event coming and they cancel, this is regarding that. If you're a restaurant, you have major parties that are committed to rooms and catering services, similar types of things. I think that's what everybody's talking about in regards to cancellation policy. Thoughts on that? Anybody?
Yeah, on our website, our amazing member Ron O shared with us some language from IHG, and they had adjusted their cancellation policy, and they made it specific about the time frame. But I think right now, especially in Allen County, where the county is actually recommending that groups of 50 or groups of 50 or more just reconsider whether you're going to have your event. I think it's something to think about. I don't know that I can recommend that you should or should not. I think you should keep your eyes on the Department of Health's website and see if you need to start see its recommendations as to whether needing to start cancel large groups and conferences outside of King County. But I think for especially walk-in properties, just considering what kind of guests you have. Maybe you have return business travelers. Maybe you have families who come and stay with you for a family reunion the same weekend every year, and you want them to come back. Just consider the language and how you want to treat that guest so that they will come back in the future. And again, we do have a sample policy on our website at wahospitality.org.
And for larger events like conferences and such, you'll want to be taking a look at what the cancellation policy already says. It may cover something that has to do with a public health order. And so you'll want to be getting some legal advice from your team about whether somebody were to cancel, what the rights are or what the remedies are that have been spelled out in that contract for the event.
Great idea, Catherine.
What should we do if a guest shows flu-like symptoms? Samantha, anything from any advisory from DOH on something like that?
I think this is a tricky conversation because you don't want to discriminate anyone by from symptoms. So I think that what our national partners have said and suggested, as well as DOH, is just to provide guests extra sanitizer, tissues, and things to help combat the symptoms and cross contamination of potential flu-like symptoms. But I would definitely not recommend targeting anyone if you think that they have flu-like symptoms.
All right. Any other thoughts?
I think this is where, just like we would with employees, asking the question is, how are you doing? Is there anything we can do for you? Not only is the right thing to do from a hospitality standpoint, but you may get information that would be useful for you to know from a safety and sanitation standpoint. Sometimes it's how we ask the question as opposed to demanding that the guest now take a temperature and verify they don't have the virus. We can't do that, but we certainly could say, how are you? Are you feeling well? Is everything okay? And then I think really what Samantha is saying, we, the management, are going to take note of that and know that, that room's going to be cleaned extra or all of that as well, so that there is something that we can do to handle. I'm guessing this is what folks do in flu season already, and I think we should borrow those practices here.
Great. What should we do if our business is impacted by the coronavirus? It sounds like it's something everybody could probably chime in on. Jillian, you want to start?
Yeah, absolutely. So
Can you speak up, please? Sorry.
So on our website, I have updated the Employment Security Department's list of programs that can help businesses impacted by the coronavirus right now. The list is it can help with unemployment insurance, paid family medical leave, a great program called Shared Work, and standby status. And so my understanding is that it's on you as the business owner to reach out to the Employment Security Department and initiate these programs, but they are definitely worth a look, as I know that lots of members are either laying off staff members or significantly reducing hours. And the Employment Security Department, I know through the Shared Work program, will come in and help provide some replacement wages for those who have had their hours reduced. So So it's definitely worth about a 5-10 minute look on the Employment Security Department's website just to start investigating those resources.
And I'll just jump on that. There's some technical things to be thoughtful of if you're expecting unemployment benefits to be able to cover your workers. I deal with this a lot of times when we have an economic downturn as well. So, for example, if you're going to be reducing the hours and the pay of folks who are exempt from overtime, they're not going to be eligible for unemployment if they're still working part of the week. You also could have issues if you start to reduce overtime exempt folks' pay because we've got rules about the salary basis portion of the test. There's also the 7-day waiting period for unemployment, and that is not waived in these circumstances. So, and you also may, if you pay the employee for that 7-day waiting period, trigger some issues with them being eligible for unemployment. So I think the best place to start is what I was actually going to say, Jillian, which is go ahead and have a look at the website and see what options you may have. But this may be beyond we're just reducing our business hours or having somebody work one fewer day a week. This would be more in the sense of I need to lay off 3 of my folks for a 4-week period, and I want to know if they're eligible for unemployment benefits in that context, and they may very well be. And then keep in mind too, the paid family medical leave is not going to be available unless somebody's actually ill. And they have that 10-week waiting period now, right? Because they're so backed up. So if this changes it, that could very well increase it, and it increased the waiting period for approval of benefits, and we're going to want to be helping our employees with figuring out what to do until they can collect something. It's going to be tough.
I got a follow-up question from Jay on that, but isn't shared work for full-time employees? We have mostly part-time work.
Yeah, thank you, Jay. I just did a quick look at the Employment Security Department's website for that program. It did not initially say just full-time, but it did say that there are eligibility requirements. So if you click that link, I think it's worth investigating, unless somebody else who's presenting today does have that answer.
Jillian, is that link on our coronavirus resource toolkit on the website?
Yes, sir, it is.
Okay, so I'm going to post a link to that website now, everybody, so you can access that. Jay had another question. Is the association working for financial relief for lost business to small business through this? We're just 2 miles from Kirkland, the Kirkland Nursing Home Epicenter, and business is down 85% over the last year. As a small business, we're concerned about lost hours for employees. Thoughts?
Yeah, that's a great question, Jay. And to answer that, yes, we are doing everything that we can to get this issue in front of key lawmakers with the remaining 4 days of the legislative session. We do have a conference call scheduled with the Secretary of Commerce, state leaders from the Employment Security Department and Labor and Industries, as well as the Governor's Office and major industries in the King County area, as well as the local chambers there in the King County area as well, to express the concern that we all have. We are also working with ESP, the Governor's Office, on emergency rulemaking to see if we can get critical changes to those unemployment insurance programs so that if our employees are not eligible for those benefits, we might be able to do so temporarily during the coronavirus outbreak. Catherine and Jillian mentioned the shared work program. There's also standby layoff that you can do if you do have a target date for employees to return to work. That benefit is only available for full-time employees. So there are a number of different tweaks we're trying to make so that our employees can be eligible for those benefits and that you can retain the staff that you have, and when you're back up and running, you can bring those trained key staff back.
Okay. Another question from Karen. I'm from Scaggs County, work at a hotel. We have lost over $60,000 in the past 3 days. Is there going to be any way for hoteliers to recoup any losses?
There's not.
Okay.
I guess I'll just add on to that. I know that the federal government just passed some sort of coronavirus relief, and that is included some small business loans that folks can get to help bridge the gap between now and when the outbreak is over. But at this point, there is nothing available. We're doing everything we can to get those issues in front of the lawmakers. And we will absolutely keep members informed on any changes to that.
That's pretty much it. Just kind of going through the room until we get more questions here. Any final thoughts from everybody that you need to be extra diligent on? You'd like to share with the industry right now? I guess, Kathy, can we start with you?
Yeah, I just think that there needs to be thought to employee planning. So employees who are ill, may become ill or exposed, decide how you're going to handle that now. You'll need to make some decisions about what to do if folks don't have paid time off available, which I think is going to be tough, particularly for part-time workers. I do not have the answer. I did hear on the radio this morning that there is an employee relief fund that's starting to be set up for the city of Seattle. So I imagine the association will be providing some more information on that. And then the next thing is the time to think about what you can do to cut labor costs isn't a day before you want to lay a bunch of people off. When I've been through folks in long-term planning, there are things you can do short of layoffs, which is cutting hours, maybe talking to even your exempt folks about taking a reduced salary and getting an additional day off a week. Some things there that you can think about now, if you needed to put those measures in place later so that it's not a frantic phone call to ESD about what you're going to do if you have to lay a bunch of folks off. So I know my clients are watching their business pretty clearly and carefully and every day. I agree with Jillian that it's more of a King County and city thing at this point. But to be on top of that so that you can maybe be thinking of some ways to cut costs now if needed, so that we're not having the panic later.
Great. We got a question from Brianna. What can we communicate to employees if we know we have had a confirmed case of the virus at the property?
So we shouldn't be outing anybody's medical information, which is saying if it was a guest or a specific employee by identifying that person by name. But you should go ahead and communicate with your team that there was a confirmed case at the property. And then you're going to need to think long and hard, and it should be thoughtful about who needs more information in that. For example, if it was one particular guest room, I think you're going to have a little bit of a different discussion with the folks that were cleaning that room. This might be where you're deciding whether to send some folks home for the incubation period and maybe even offering paid administrative leave. For example, if there was a housekeeper who came in contact with that guest room I'm thinking of. Same if there was an employee working in close contact with somebody. This is where you are going to want to weigh the business reasons about whether it's good to just go ahead and have that employee who may have been exposed stay home, and whether you're going to allow them PTO usage or do paid administrative leave.
Okay, any more thoughts on that?
Add with this is if there is a confirmed case to the public as well as your guests to really focus on sanitizing your area. I know there have been some outbreaks from Starbucks in Seattle, and they've done a great job of letting everyone know that they're doing their due diligence to clean the property head to toe. And so I think just continuing having those discussions and focus on sanitation is important.
Okay, closing thoughts, Jillian.
Yes, I had a great conversation with the lodging operator on Friday, and she reminded me that even more contagious than coronavirus is calm. And right now, when we are being role models and leaders in our communities, that calm that we exhibit can have an amazing effect on our employees, on our guests, on those who we are interfacing with. If we are talking to a city council member or a state legislator about the state of our business, absolutely own our reality. Things are not all rosy right now, especially in Seattle and King County in terms of business. But coming across in a calm, rational way is really going to be the best thing, especially for your staff right now. I did see over the weekend a very, very desperate cry for help from a restaurateur in the Seattle area, and while that is so valid and exactly what that person was experiencing, that actually
I've lost audio. I don't know if I'm the only one.
Oh, no.
Let you know, Lex.
Okay, we can hear you still. We can still hear you.
Okay, I can't hear Jillian.
Okay.
That type of social media post could actually increase the panic, especially among that person's employees. So just keeping in mind, calm is contagious, and while it's really, really hard right now, you are a role model, you are a leader in this.
We have a special guest with us, Anthony Anton, who's the CEO, president of the Washington Hospitality Association. Stepped in. Anthony, you've got some words for the industry?
No, actually, I would just be curious. We are focused on getting you, our members, great information. Today's webinar and the special page for coronavirus is correctly on our website. Our team and Julie and Sam and John in Seattle are working on whatever relief packages are viable that we can actually get through to try to help. Is there anything else that the membership that you would like us to be working on now that we should take under consideration? So more of a question to our listeners, people on the call today. What do you not seen from us, or other things you'd like to hear from us?
And you can just add that into the chat if you'd like to add your thoughts on that. Closing thoughts, Julia?
I think everyone else has summed it up perfectly.
Samantha? All right. Okay, with that, Jillian, who should we, if members have a follow-up question in regards to this topic, where should they send an email? Who should they call? Should they contact their representatives in their particular area? Should they contact the office? What are their recommendations?
Yeah, my first recommendation, which will save them the most time, is if they have additional questions to go to our website, wahospitality.org, and click on our coronavirus information. If you don't find there what you are looking for, don't hesitate to send me an email to jillianh@wahospitality.org, and I will pop it into the chat. And then as far as legislators or city council members, I would actually throw that over to Julia to see what she would recommend.
And we're getting some of the feedback from the folks who have called into this conference, providing a list of preferred cleaning providers. In the case of property needs to be closed and cleaned, would be great. So we'll work on that. As we run low on hand sanitizer, does anyone have a good source? I know that going to the mall this weekend, hand sanitizer was not to be found anywhere. Another one is from Patrick here. It would be great to see a press release from the association regarding what we would do for best practices, help with public ease a day, and we are working on some public statements. So Jillian, I think you're working with the team on that, correct?
Yes, I was answering Clayton's question.
Oh.
Say that again.
A press release from the association regarding what we should do for best practices.
We have resources on the website right now. Each time that media is calling, I am letting them know about our best practices. So at this time, we will not be sending out any additional press releases.
Okay, so it's the website and social media that's kind of our avenue at this point. Okay. We have a question or another comment. Unemployment asks for increased weekly minimum, open shared work for part-time, remove 7-day waiting period during the emergency. Up in Skagit County, we understand it seems to be more cases south of us. However, we host many soccer and Frisbee tournaments and the Toledo Festival. Most of the teams are coming from Marysville to Olympia. We are all getting hit hard. We have procedures in place. And finally, from Karen here, we have I looked online for hand sanitizer, and we got a shipment today. So there is some hand sanitizers out there. So we've got that. Okay, so this webinar will be is recorded and will be shared with the community. We'll clean it up a little bit. We are planning more resources like this in the future, and we'll try to work on cleaning up some of the audio for you. Try to troubleshoot that in the meantime. But in the meantime, again, I'd like to reiterate that if you go to the Hospitality Association's website, this resource is updated on a daily basis. And please do reach out to us if you have any further questions. I think provided her email address there. Unless there's any other things, we'd like to conclude this meeting. Thank you very much for your time, and we look forward to supporting each other.
Thank you.
Thank you.